wonderful sensory organs. They help people learn about the world in which they live. Eyes see all sorts of things, big or small, near or far, smooth or textured. But what happens to our eyes when we have this condition called macular degeneration?
What is macular degeneration? It is the leading cause of severe irreversible vision loss in people over age 60. This occurs when small central portion of the retina, known as the macula, deteriorates. Because this develops as a person ages, it is often referred to as age-related macular degeneration, or AMD.
There are two types of age-related macular degeneration, the dry form and the wet form. First is the dry form. The dry form is characterized by the presence of yellow deposits called drusen in a macula. In atrophic form of dry AMD, patient may have blind spots in the center of their vision. In advanced stages, patients lost central vision. The second type is the wet form. It is characterized by the growth of abnormal blood vessels from the choroid underneath the macula. These blood vessels leak blood and fluid into the retina, causing distortion of vision that makes straight lines look wavy. What are the symptoms of macular degeneration? First sign is usually blurred vision. Other symptoms are decreased quality or resolution of vision, dark, blurry areas in the center of vision, diminished or changed color perception. What are the risk factors of macular degeneration? Macular degeneration may be hereditary, meaning it can be passed on from parents to children. Smoking, high blood pressure, high cholesterol, obesity, being light-skinned, female, and having a light eye color.
Diagnosis for macular degeneration. Routine eye exam. Presence of drusen or pigment clumping. Hamster gray. Pattern of straight lines that resembles a checkerboard. Some of the straight lines may appear wavy to you, or you may notice that some lines are missing. Angiography. To see whether there are new vessels or vessel leaking in the macula.
What are the treatments for AMD? Anti-angiogenic drug. Your doctor injects these medications into your eye. They stop new blood vessels from forming and block the leaking from the abnormal vessels that cause wet macular degeneration. Laser therapy. Your doctor may suggest a treatment with high-energy laser light that can sometimes destroy actively growing abnormal blood vessels from AMD. Photodynamic laser therapy. Your doctor injects a medication into your bloodstream, which gets absorbed by the abnormal blood vessels in your eye. Next, he shines a laser into the eye to activate the drug which damages the abnormal blood vessels.
Baby, wag ka nang mag-alinlangan pa. Alam mo naman talaga.
What is acoustic neuroma? Acoustic neuroma is also known as schwannoma. It is a non-cancerous and growing tumor that develops on the main nerve leading from inner ear to brain. Branches of nerve influence balance and hearing that can cause hearing loss, ringing in the ear, and unsteadiness. What are the symptoms? First, we have the hearing loss, ringing in the affected ear, unsteadiness, dizziness, facial numbness, weakness or loss of muscle movement. What are the causes? There is no known causes of acoustic neuroma, but patients with neurofibromatosis type 2 have a malfunctioning gene on chromosomes 22. It can develop on both sides of head. What are the risk factors? First, we have the genetic disorder, and also the neurofibromatosis type 2, or also known as autosomal dominant disorder. What are the complications of acoustic neuroma? We have the hearing loss, facial numbness, difficulties with balance, and ringing in the ear. So what are the diagnoses of acoustic neuroma? We have the hearing test or the audiometry. You hear sounds directed to one ear. The audiologist present range of sounds of various tones and asks you to indicate each time you hear sound. And next is the imaging test, and we have the MRI.
What are the treatments for acoustic neuroma? Stereotactic radiosurgery uses many tiny gamma rays to deliver a precisely targeted dose of radiation to a tumor without damaging the surrounding tissue or making an incision. Stereotactic radiotherapy delivers a small dose of radiation to the tumor over several sessions in an effort to curb the growth of the tumor without damaging surrounding brain tissue. Proton beam therapy. This type of radiation uses high energy beams of positively charged particles called protons that are delivered to the affected area in targeted doses to treat tumors and minimize radiation exposure to the surrounding area. You may need surgery to remove an acoustic neuroma depending on the size of your tumor and hearing status.